I'm Dr. Bill Sterett. Today we're going to talk a little bit about biologics as a global thing that has to do with stem cells. So what are stem cells? Not all stem cells are the same. Biggest thing to know is whether a stem cell is pluripotential or multipotential. Pluripotential means it can form anything, and that's usually like when we have the embryonic stuff or cord blood, that it can form anything. It can form a brain cell, it can form a bone, it can form cartilage, it can form muscle, it can form an eyeball. Those are pluripotential stem cells. Multipotential stem cells are things that can only form certain things. So for me, I'm aspirating the bone marrow because those are multipotential cells, and those cells can only form bone, cartilage, and ligaments by and large, and some muscle and tendon, but basically collagen. Multipotential works great for me in my world. Pluripotential wouldn't work great if I needed to form anything. The problem with pluripotential cells, and this is the next step to talk to your friends about, if it's truly embryonic or cord blood cell, that means it's somebody else's tissue. And think about it, when we have a blood transfusion, you have to get cross-matched, don't you? ABO cross-matched. Well, why don't we have to get ABO cross-matched when we're getting cord blood cells? It's because those things have to be processed so that you don't have reaction to it, and by the time they get processed, they really are growth factors, not stem cells. We're not at a point just yet where we can really harvest cord blood, not process them, and then give them to you in a safe manner, whether it's reaction or rejection failures, whether it's you're transferring all sorts of unknowns from those cord bloods, whether it's a disease transmission or even hereditary things that we don't know how much are transferred. Think of it in terms of mental health and all these other factors that we just don't know enough about. So the cord blood cell has so many growth factors. I'm a big fan of using those for some of the things that we're asking to heal. But don't think of them as pluripotential stem cells like they were when they were harvested. They're just not by the time we get them inside of you. Multipotential stem cell that's your own tissue has a lot of goodness to it. The downside is they're not pluripotential, but they are your own cells. The pluripotential are great, but unfortunately they usually have to be processed, so that they're really not true cells that can be grown. They really are just growth factors by that time. I think in the next 5 years, 10 years especially, that's where we're going to get to, where we can get these pluripotential cells that we can expand in this country and turn 2 million cells into 20 million cells into 100 million cells, and in a pluripotential fashion, and be able to use it for you. I use a lot of these on every surgery I do, from meniscus repairs to ACLs to rotator cuffs, trying to increase Mother Nature's ability to heal these things. As we age, we get less able to heal some of these things I sew up. So ask us about all of these things. I love talking about it. I think this is the next generation of all this. We're not going to get better and better at surgeries. We're going to get better and better at speeding up Mother Nature for all this. I'm Dr. Bill Sterett with another one of your Sports Medicine Minutes.